happy. Hi, everybody. Happy Saturday. We're so excited to have our guests with us today. We're so happy that you all joined us today. It is so thrilling. We have a couple of people in the room, and we're excited that we're going to get back to, I'm hoping by the first of the year, to in-person doc talks. This is our last doc talk of the year, and this is going to be a really amazing talk. I'm so excited. These ladies are amazing. So this is a little bit of a hybrid lunch and learn. We don't really have lunch in here. We've got cookies, women's fun cookies in here. There is some healthy fruit over there that is for noshing. I hope you guys are having a wonderful, I guess we're kind of at brunch right now, brunch at home. So on behalf of the Women's Fund, we want to welcome you to our final doc talk of the year, a little hybrid lunch and learn. We've got a really nice agenda for you that is lots of insight, some personal stories that I know folks are going to share, and it's so great to have all of you with us today. As you guys know, the whole mission of the Women's Fund is to provide Houston area women and young girls all the tools they need to be advocates for their own health. I mean, that's what's key. It's great to have the healthcare experts, but even better when you can add to that your own advocacy and you've got the knowledge to be able to do that. Our health education classes are so unique because each one of them includes preventative curriculum that when you couple that with classes and teaching resiliency to folks, those things can really help mitigate some of the health risks that a lot of us face. So as you're tuning in today, I want to take just a moment to commend you on your curiosity, your braveness. As we will talk about today, this is a personal issue for me. It's personal for many of my girlfriends, and not just my girlfriends, but my friends, they're guys and husbands in families. So it's not just women. So really take some time today. I know I thought about this as I was coming in today to practice a little bit of self-care. Give yourself a little love today, because I know this can be a little bit heavy, a little bit of a heavy discussion. So infertility, as many of you that are tuning in know, results from female factors about a third of the time, male factors about a third of the time, and then we don't know about the other third of the time. So cause could be unknown. Female infertility especially can be really difficult to diagnose. There are many treatments, many things that we can do, but depending on what the cause is. And many infertile couples who seem to deal with infertility then go on to have healthy pregnancies in the end. So that's always good news. So we want to bring some awareness to this topic on fertility. We want to take kind of the darkness out of the infertility discussion and bring some light, having this open discussion with our experts today. So we're going to proceed with the conversation for just a moment, but just a kind of a way of thinking about how the conversation is going to go. We are going to save about 10 or 15 minutes at the end of the discussion for questions. I know that you folks at home have them. So what we're going to do today is kind of go through our discussion here, and then we'll take all those kind of questions at the end. So don't worry, put them in the chat. We'll get to them. After this is all over, if you want to share this discussion, the Women's Fund will post the entire discussion, the recording of the conversation on our website and also on YouTube. And we'll get that up so that you guys can watch it again and maybe share it with people in your life that you think might find it really useful and insightful. So before we get started, just a couple of meeting rules. We love rules around here. So if you're at home and you haven't muted yourself, go ahead and mute yourself. And then, of course, as we mentioned, if you've got questions, go ahead and put those in the chat and we'll get to them in the end. So we have some really amazing speakers in the room with you. This is such a treat. Dr. Wanda Mott. Hi, Dr. Mott. We also have Dr. Shauna Mason. Hi, Dr. Mason. And Leslie Murphy. Hi, Leslie. So Dr. Mott has practiced as a board-certified obstetrician and gynecologist for more than 20 years in the Texas Medical Center. Dr. Mott is a Phi Beta Kappa member and a magna cum laude graduate of Smith College and received her medical degree and residency training at Baylor College of Medicine. She's a proud Houstonian and a product of Houston schools. She has advanced certification and experience in procedures such as colposcopy, gynecology, laser surgery, endometrial ablation, advanced endoscopy utilizing laparoscopy. Did I get it right? That's good. Yeah, I got close enough, apparently. Moreover, Dr. Mott was the 5th gynecologist to be certified in MRI-guided focused ultrasound. So thank you for being here, Dr. Mott. Dr. Shauna Mason is a board-certified obstetrician and gynecologist. She attended Rhodes College in Memphis, Tennessee, earning Bachelor of Science degree in biology. She was a member of Kappa Delta sorority and the Biology Honor Society. She completed her training at the University of Texas Health Science Center, Houston, and Memorial Hermann Hospital. During her time in training, she served on the Residency Selection Committee and was selected as Outstanding Chief Resident in Laparoscopic and Minimally Invasive Surgery. She maintains privileges at the Women's Hospital of Texas in the Medical Center, and she provides full obstetric care, including preconception counseling, infertility, high-risk pregnancy, and focused postpartum care. She enjoys seeing her patients build the families of their dreams. Thank you for being here. And Leslie Murphy is a licensed clinical social worker with 30 years of experience. Leslie has a unique specialization in women's health, providing counseling and wellness services across all stages and ages of life. Leslie operates a private practice in the Memorial area where she offers individual counseling, psychoeducational consults, and psychological evaluations. She also offers a monthly infertility support group and quarterly wellness retreats. Leslie offers a nurturing and engaging environment which helps clients to achieve insight, regain hope, and move forward. She received her master's degree in social work from Florida State University. This is an amazing panel. We're so excited that you guys are with us today. So we're going to get right into diving deep into all things maternal health, not just infertility, but maternal health in general. And I promise that a lot of you folks are going to walk away with some answers, some of those questions that you have. So welcome, Wanda, Shauna, Leslie. So I'd love to start by talking just a little bit about, when you're thinking about starting a family. I feel like I have a lot of friends of mine who are at that point in their life where they're getting to that point. Career and education is settling in. They found their partner. They're thinking about starting a family. What are some things that people should be thinking about?
I think the way I talk to my patients is just thinking about being your best healthy self. I mean, I think that's the way you want to go into pregnancy. So are you managing stress well? Are you getting good sleep? Do you eat well? Do you exercise? And sort of starting to incorporate that as your baseline routine, that you just want to go into pregnancy being as healthy as you can. I think things we talk a lot about are just, making sure you're taking prenatal vitamin, that makes sure you're getting enough building blocks that help the baby in those early weeks before you often come in to see one of us. That's kind of how I talk to patients about it. When they're just thinking about general, like, how do I make sure I'm ready physically to have a baby? It's just kind of a general statement.
I would agree. I think that certainly we are finding that families are deciding to have children later on in life. Yeah. You talked about careers, you talked about education. Certainly we are getting those things in mind. So it is not unusual for us to see women in their 30s and 40s beginning their families. Certainly we know that medical illnesses, certainly across the board, will be more prevalent at those times of life. Years ago, women were having their children at 20. 18, 30 was considered late, okay? But this is not late for us. So certainly keeping yourself, as I was saying, in the best of health is going to be the best thing. Certainly developing high blood pressure, diabetes, heart disease, any medical illness, getting that under control and making sure, and certainly when you're working hard to get your career started, your stress level is very high. Pick a time that you're not planning to be promoted, okay, to get into a pregnancy, because pregnancy is a stressful state on your body itself, and it requires you to make sure that you've taken time out for that. Having children is a big job. It's the biggest job you'll ever do, and certainly it is the most glorious thing, okay, that we will ever experience, but it requires concentration. The same type of focus and concentration that you had for getting through college, getting an advanced degree, you need to put into pregnancy and getting that done. Yes.
So Leslie, when you think about, like Dr. Mott said, you're having a conversation with someone who's maybe 25 versus 35 or 40, is that conversation different when you talk about thinking about getting pregnant?
Absolutely. And I think as I was listening to Dr. Mott speak, what I am seeing a lot of women who are really considering preserving their fertility. So they definitely want to have a family, but maybe they're not ready, whether that's due to career challenges, whether that's due to they haven't found the right person yet. And so depending on that, their ages and kind of where they are, I think that's a big part of what I'm seeing. A lot of these wonderful, fabulous what we call single mothers of choice, possibly who are making that decision. And I think just going along with what both of these physicians are saying about looking at your own stress level, there's never a perfect time. But being able to say, okay, what are some things I can do to be proactive and preventative to be able to make this journey a little bit more smoother? So yeah.
Well, I heard two things there that I want to talk a little bit more about. Talk a little bit more about this never a perfect time, because I often hear people say that, you know, oh, I'm just waiting, we're waiting for the perfect time. I'm waiting for the perfect time. Is there such a thing?
Well, I think it's not quick. It's often not quick to get pregnant. It's often not quick to grow a baby inside of you, right? And so I think sometimes we don't always think, it's hard to think that far into the future for some couples. And so it feels like there isn't a good time because they anticipate it being a long process. And that is true. So I think that's kind of what you have to factor in, that there isn't ever a perfect time, but you do want to be able to give yourself the space to be pregnant, stay healthy, you know, be able to manage your work stress, be able to leave work for a period of time so that you can take care of your newborn and take care of yourself. And so you just have to kind of be a little forward thinking in that timing. And that may be the overwhelming part. It's just knowing that it's sometimes tricky to get pregnant, and then it does take time to have a baby and nurture that child afterwards. So,
And then talk about, you know, Leslie, what you were just speaking about, you know, a lot of, I think about, you know, many of my girlfriends actually, you know, they've had successful careers, haven't quite found the right partner yet, but they don't want to miss that opportunity to have a child if they do decide that they want to get pregnant a little bit later, maybe than would be optimum according to the way the body works. You know, talk about that, maybe that conversation about freezing your eggs and what that might look like.
Harvesting is something that is often discussed.
Yeah.
And certainly there are many assisted reproductive technology groups that are throughout Houston, okay, that are available. And certainly they have opportunities to talk with you about how to save your eggs, about when you would want to save them, about what you should expect over time, when you would want to come back, what would be the best time for you to do this. And certainly we get into the conversation as to whether or not, especially when you're talking about people that are, or ladies that are waiting, okay, for the right person. Women get to a point, and I talk to women in my office, they get to a point where the right person is not coming. So I'm gonna make the decision. And certainly that's a conversation that has to be had, not only with yourself, but also I think, okay, with other people in your family, because raising a child is a joint project. It is not an individual thing.
Yeah, even if you actually have a partner.
Yes, exactly.
It's still very difficult.
You need help. You need help.
Right?
And I think talking with someone about that, talking with Arts about that, assisted reproductive technology, getting information from them so that you know what is available is certainly very helpful. And it helps you to make that decision. That's an individual decision. Okay.
Because I can see people at home right now, you know, because this would be me, I'd be Googling it, you know, like, okay.
What's art?
Right, well, and what age should I be doing that? You know, when is the best time if I'm thinking about it? When is too late? How do you even begin to have that conversation? Do you start with your gynecologist?
I think so, yeah. I mean, knowing it's
Definitely.
available, right? And the way I talk to my patients, very young, I mean, in their 20s, right? And I start asking, have you thought about this? It's a savings account you may never need. That's kind of how I describe it. And that way it keeps your fertility window open beyond what we used to have access to. And the results are showing that it's incredibly effective in maintaining your fertility into an age where you want to focus on your career. It's a choice. You're maybe with your forever person already, but it's your choice to not have children yet. Or you're waiting on your forever person, or you are just focusing on the next 5 years and you know that doesn't include a family quite yet. You know, there are these technologies available, or if you reach a point that you want to have a child on your own, it allows you the space to kind of live your life. But if you are still healthy, I mean, I talk to patients a lot about if you've acquired a lot of medical conditions and it still may not be safe for you to carry a baby in your 40s, but assuming you're still very healthy, it may be so difficult to get pregnant at a later time that this allows you to keep that fertility window open for so much longer than the previous generation had access to.
Yeah, and really, I mean, just medically speaking, it's no big deal to grab 20 of these eggs you've got plenty more in theory if you're 25 or 30,
You're
right?
hundreds of thousands.
Yeah.
Right, you're not
Right.
reducing future
Right.
fertility by
Right.
taking
You're
that,
good.
that is true.
You're
Yeah.
good, you're good, you're good. And certainly it allows you an open window, because women are always talking about, my time is running out, okay? Your time is never running out, okay? We have an opportunity to achieve pregnancy. But certainly, we know that with assisted reproductive technology, at a certain point, the eggs are better, okay, than they are at other points. So we'd like to have those eggs available. It may be at an age, okay, where you would not have appropriate eggs, but you saved them because you took them at 30, okay, instead of waiting to 35 or 40 to take them. And that gives you just so many possibilities.
Well, and I also feel like it helps a lot of these women feel more proactive and feel when they are feeling the pressure, they're seeing their friends get married, they're seeing their friends have their first child, their second child, and so they're feeling this pressure and feeling behind sometimes. And so this is potentially a way for them to feel, you talked about, what do you call it, the
Savings
Yeah,
account, you may never
savings
know,
account.
yeah.
like kind of big insurance policy.
Yeah.
And I have had women go back and use those eggs. I've had women go back and get those eggs and use a sperm donor. I've had women say at some point that maybe they didn't need them, or maybe they decided not to use them, but it just, again, gave them a sense of that it's something that they can control.
Well, no, so you just said something else that made me think about the pressure that, that women and couples are often under from not only themselves, but from outside forces. So how any thoughts on how people can kind of deal with that? You know, we're coming up on next week, Thanksgiving. A lot of folks are going to be together. I can imagine there's some new couples out there that, you know, a well-meaning aunt, mom, grandma is going to say, hey, when's that's right, when's that little one coming?
So much pressure.
Yeah.
So a couple of things with that. Absolutely, the holidays are going to bring that up this next month. People are together more. You're also seeing more announcements and Christmas cards, and that can be triggering. And so I always really encourage couples to, first of all, get on the same page. So with however they're going to answer, to whether it's friends or family, that they're on the same page with that, so that, you know, she thinks that they're saying, oh, we're not saying anything yet. And then the husband's like, oh yeah, we're doing this. So being on the same page can be helpful. And then the other part of that is it can bring up emotion. And so really come from a place that, and you said this, that the idea is that it's well-meaning. And so typically, you know, you're at a Christmas party or you're with family and people are making conversation, or they're trying to connect, or maybe they really do want those grandbabies, but coming at it from a place of, okay, take a deep breath. Most of these people are well-meaning. Decide how you're going to respond before you go to Thanksgiving. Have a kind of a canned response that doesn't invoke emotion, that you can process. And that I find particularly helpful.
I think that's really very helpful, especially for couples that have been trying to achieve
absolutely.
pregnancy. Having something that you would know that you can say as a couple before you go, so that you don't have all of that emotion.
Yes.
Because certainly when you're trying to achieve pregnancy, and if you're having difficulty achieving pregnancy as a couple, then that often creates tremendous stress, okay, on the marriage, on each individual. And certainly anyone that comes out that is involved in that on the outside can really trigger all kinds of responses. So I think it's certainly your suggestion of having a canned response, something that you're going to say already, okay, so that you don't have that happen.
Well, and what about the idea that if you are going through things, you're struggling with things? I find that generally people they don't feel comfortable being super open about that. My wish is that people would be, because I think there's inevitably somebody else in the room who's going through the same thing, whether we're talking about infertility or something else that's going through the same thing that you are. Thoughts on being able to share that with people, maybe not at the Thanksgiving table, we don't do it there, but how do you start having that conversation, maybe with people that you'd like to have it with, you know, whether it's a sister or a mom, you know, maybe even a girlfriend or best friend?
I always start with what is your motivation in sharing? So are you sharing so that you can gain support, or that your family or friends can be understanding, or that they understand. I've got a lot of clients right now that don't want to go to Thanksgiving dinner. They don't want to go and be around the newborn or the pregnant family member. And so helping them to explain that, whether that's in an email or through their partner, sometimes their partner can be a good person to explain that. What I have found, and I'll probably see, is that the more that you're sharing, the more people are saying, oh, me too, or that happened to my sister, or, and so that can help with that isolation. So I think, again, it's probably, again, going back to if you are partnered and having that discussion together.
I think it's, the loss of what you thought was going to be, right? And I talk to patients about this a lot through, miscarriage and pregnancy loss. It's so common, right? And so as quickly as those words come out, but it's so private, right? People just don't talk about it. It's hard and it's sad and it's a loss. And so I think once you kind of find the place for that grief, that if you are willing to open up a little bit to your closest support, you may hear the stories that help you remind you that it's not your fault and that it is common and that lots of couples go through this. It doesn't change how hard it is for what you're going, but I think it can normalize it. So I do try my couples who are struggling with infertility and who have had, pregnancy loss. It's not what they want, but to just try to open up sometimes, because it may at least normalize it. It may give them a bigger support system than they thought was really there. So
yeah, there's a wonderful program called Hope Mommies, and they are such a wonderful support to women who've had losses. And they do something almost every month. They have different support groups. In October with Pregnancy Loss Awareness Month, and they did a program of releasing butterflies. They're doing something special in December. And so going back to what Dr. Mason was saying about having, again, your village or not feeling alone, and hearing somehow also how other women are sharing or how they've dealt with it can also be helpful to help them figure out, oh, well, maybe it would be helpful. Maybe I don't need to post on Instagram, but I can share with my circle.
Yeah, I often tell people that one of my greatest lessons in life was that when I was trying to get pregnant, when I was going through infertility, I had this really circle of girlfriends who were all kind of going through the same thing. And it was really helpful. And it was helpful not just because we were kind of all in it together, but because we all learned from each other. And it gave us a space to share, hey, this is what I'm going through today. And you'd hear from the others later in the process. Maybe you were ahead of the game on somebody else, then they would share and say, it really helped when you told me what had happened with you. It made me feel not so quite alone, even if they weren't quite even ready to share it themselves. And so sometimes I think just sharing, again, when it's safe and comfortable for you, you can't just share it just because, but it's got to be right for you. But that benefit, normalizing it, for somebody else. Because as you said, what are the numbers on miscarriages? It's a high number, isn't it, of women who will go through it?
1 in 4
1 in 4 pregnancies, not just 1 in 4 women, but 1 in 4 pregnancies. That means there's a good chance that the people that you're sitting with have had a miscarriage.
Yes. People don't talk about that. They only talk about the yes, but certainly when you have relationships and developing relationships over time are so important, and you are able to share those things.
Right. Yeah, and that's key. You've got to have your own health. You've got to make sure you're in a space.
Safe space. Exactly.
Yeah, I love that. So I'd love to talk a little bit about one of the other things that a lot of folks are challenged with right now, which is COVID. And is it a good time to have a baby? Is it safe to get a vaccine? So many questions. Where would you guys kind of like to start? I feel like that's its own kind of.
That's a big topic. COVID. Is it safe to get a vaccine? Yes. Are we encouraging you to get a vaccine? Yes. Are we encouraging it in pregnancy? Yes. Are we encouraging it in breastfeeding? Yes. Because women that are pregnant have a lower immune response, and they are at much greater risk. Certainly, I'm an employee of Texas Children's Hospital, which is the 4th largest women's and children's hospital in the nation. Certainly, they're participating in many of the studies, and they are a part of the healing that is taking place in Texas from COVID-19. So we see some of the most difficult entities associated with that disease. And so we are encouraging our children, now that they can be vaccinated at 5, yay, to be vaccinated, because we want everybody to live through this pandemic. So we're really encouraging, certainly, the immunization, okay, for pregnancy, and I think the World Health Organization is encouraging it. The Society for Maternal Fetal Medicine is encouraging it. The American College of Obstetrics and Gynecology is encouraging it. So they are looking at the studies that have taken place. And certainly everything tells us that certainly pregnant women are at greater risk for very severe disease associated with COVID-19. So definitely we are encouraging it, yes.
And I think now we have data, right?
Yeah,
I mean,
we
it
have
was
lots of
really
data.
hard. I mean, it was hard for us as physicians to practice medicine with no data. That was a very uncomfortable time, which I never thought that was going to happen, right? So it was stressful, but now we have really good data. People are asking the very questions that patients are asking and studying it. And we've side by side compared vaccinated and unvaccinated people. We've side by side compared, looked at those pregnancy outcomes. And thankfully we didn't see complications like stillbirths or birth defects or preterm labor or any of those things with our vaccinated population. So now we feel even more confidently that we can say it's safe to get this vaccine. If you are trying to get pregnant, thinking about being pregnant, if you're a young woman worried about your fertility, if you are already pregnant and you haven't had the vaccine yet, it offers even a benefit to your baby, transplacental immunity, which we don't get from every vaccine, but we get from this one. So, and now we have data about that, which is, it just makes it so much easier to confidently tell patients that they can feel good about their decision during this tough time. I think it goes back a little bit to, is there ever a good time, right? I mean, it was initially maybe scary to have a baby during a pandemic, but we kind of have to accept that this is where we're at now. And so I think putting those plans off indefinitely, I think, are very stressful for couples.
Yeah.
So
Couples don't really need to do that.
They really
I think people were
don't.
concerned that it was the COVID-19 was going to affect their fertility, their
Right.
ability to achieve pregnancy. And certainly all of our studies show that that is not the case. So our lives have to go on, okay? COVID-19 is going to be with us, okay? So we've got to learn how to continue to have our families, to enjoy our lives, certainly to do all of the things that we want to do on a regular basis, and certainly we'll have to work around this. And the vaccine is helping us to get that done.
So what do you guys hear from your patients? Because I know even when I talk, I feel like, of course, these are things we talk about in life with our friends. And I have friends and coworkers who've been concerned about the vaccine, both men and women. What do you, because I know you're getting these questions, you're getting that question. What are some other things that hopefully your patients are coming to you with? I mean, they're not in a vacuum, hopefully they're talking to you.
They talk.
They're talking. They're talking.
We hear almost, I don't know about you guys, but we hear almost everything.
Yeah.
That the vaccine changes your DNA. We hear all kinds of things, okay? And certainly our job, as physicians, is to give you the facts, as much information as we can, to make sure that you're aware of everything the vaccine offers and what the problems are associated with COVID-19. But certainly if you're a patient in our office, we're concerned about you. We want to make sure that you do well and that we're providing you with the information that you need to make an intelligent decision about yourself, your family, the people around you. Those are your decisions to make. We can't change that. But our job is to make sure that we give you all the information. And that's what we're here to do. So we hear all kinds of things about the vaccine.
And I think it's a little just about listening to people's fears, right?
Yeah.
Because people are afraid. We've all been there. And just trying to really kind of tease out what the fear is and kind of then counter that with maybe accurate or helpful information versus an alternative, because the alternative to not being vaccinated is potentially COVID, and that carries risks too. And so sometimes patients don't think about it in that regard, especially when it comes to pregnancy. And unfortunately, it's a tricky time because your immune system just isn't as strong at protecting you. So I think those are the things I try to just focus on, but really just understanding that it's normal to be afraid. That's okay. This is a hard time, but what can we, help you understand about your questions to maybe make you feel better about whichever decision you're making.
Yeah. And I've seen clients on both spectrums, from they're not leaving their home, especially last year where they were only leaving going, you know, to the physician office, and then to the other extreme where they're, so but both anxiety extremes, but one where we're, you know, so COVID conscious, which is, again, there's some balance, and then to the other where there's a lot of anger and almost sometimes even hostility about getting the vaccine out of the fear and maybe the misinformation or not having the education. It also comes back to that, the pressure, family. So even coming up, I've had several clients coming up for the holidays where I'm worried my mom's gonna bring it up or she's gonna ask, and, you know, and I've got the vaccine, but I don't want her to know because she's, so it's still complicated, even though we have all of this data, and hopefully, you know, that people are.
Families are very complicated.
Yeah.
Holidays are complicated.
They are.
Sam, what are you talking about?
You guys families must be perfect. My family is very complicated. Okay? All of people are different. Okay, everybody has their own opinion.
Yeah.
Okay, and they've all made their own decisions. Okay, on what they're gonna do. So, you know, trying to avoid that conversation is extremely, extremely high on the list, because we want to have a great time at Thanksgiving, but we don't want to bring in so much discussion, okay, that it creates a negative environment. So I think maintaining those relationships are so important. You cannot convince people to do anything.
That's right.
If they are upset.
Yep.
Okay, and the people that are at your table for Thanksgiving are the ones that you love. Okay, these are the people that are most important to you in your entire life. So certainly, we're going to try to do everything we can, okay, to keep it a calm and loving atmosphere. We might not get vaccinated that day, okay, you know, but we're going to get the information. Yeah, we might have to learn to give it in a different way.
Right.
It's okay as long as we give it, okay? And that's the same thing for us in the office.
Yeah.
It's okay. I don't have to convince you today, okay? We're going to see each other again. I just want to make sure that I've given you some things to think about, because I already know you're intelligent, okay? I just need to make sure that you know both sides before you decide.
I'm just thinking about all these conversations that you guys must be having right now with folks. You know, it's become like exponential, the things that maybe you talked about 5 years ago versus the conversations that you're having to have right now. Yeah. Talk a little bit about the flu shot. I don't want to spend too much time on the flu shot, but I mean, that when you were talking, Dr. Mason, about the reduced you know, immune response that you have when you're pregnant, you know, I think about all of these things. And so it is flu season. So let's loop in a little bit why important, not just for a pregnant woman to get the flu shot, but anybody who's around anyone who's pregnant, and what a great benefit that can bring.
Yeah, I think people forget that you're just more susceptible to things when you're pregnant. So you walk on the elevator and somebody's got flu, you're more likely to leave the elevator with flu than you are when you're not pregnant. And so a vaccine really builds up a more robust immune system. So if you get on the elevator with someone with flu, maybe you're not going to come down with it this time. The same is true if your husband's going to work and he's on the elevator with someone with flu and brings it home to you, right? Maybe you're not leaving, you're home with your toddler and you're pregnant and you're all kind of hunkered down. But I think we all get vaccinated for two reasons: for our personal risk assessment, because we're worried about a disease and how ill it will make us, or to protect those around us. So because we have little people at home that could get very ill from flu, because we have a pregnant wife, because we have an ill elderly parent we see often. So I think flu still falls into that category. We know a lot about the flu vaccine and its safety in pregnancy. It doesn't transfer antibodies to babies as much as some of the other vaccines in pregnancy, but it is really good at protecting moms. And we see hospitalized pregnant patients with flu annually. I mean, it's not something we just read about. It's an actual real complication. So I think that's just try to, I mean, again, not forgetting to talk about it, not forgetting for people to think about the flu shot, because we talk so much about COVID right now, but it is a really important preventative measure you can take to help keep yourself safe during flu season.
And we're kind of going into a season where I think we start some additional conversations, all of us, about being well and healthy.
Yes.
Specifically when we're talking about people who are trying to become pregnant or maybe early part of pregnancy. Let's talk about some of the supplements, the vitamins. There's a lot out there. I can see Dr. Mott going, I can't wait to get into this.
Oh, no. Well, really, certainly planning for pregnancy is something that needs to be done, long before you actually
And how
achieve
long?
pregnancy.
Like, are we talking a few weeks, a
Well,
month?
it depends on what you're planning,
Oh,
okay? Planning related to your job. Okay, see, there are so many facets, okay, to this in planning. But when you're talking about your health, certainly you want to maintain a good health status the entire time. So you're looking 6 months to a year before, looking at what do I need to do to change my lifestyle? Okay, that's gonna make it so that I can achieve pregnancy without creating stress in my family, stress in my life that could increase my risk of developing other illnesses as well, especially if they run in my family. If hypertension runs in my family, diabetes runs in my family, if lupus runs in my family, these kinds of things, especially if you're older, okay, are things that may occur as you get older. So you want to begin to do those things. But certainly, we're encouraging everybody to live a normal life and exercise and get out and do some activity. Make sure that your diet is great, okay? And certainly we live in a fast-paced life, so what is a great diet, okay, in this lifestyle where we live, where everything is instant, okay? So trying to get as many of those additives out of your diet, not using so many things, okay, that you read on the internet, and you can go to the internet, come with a box. I've had ladies come in with, all of these things that, this is quantum whatever, okay, and it gives you, oh, please, let's don't do that. Okay, so we want to remove some of those things, but certainly taking folic acid regularly, and you need to take that at least 2 months before you achieve pregnancy, making sure you have DHEA in your vitamins. Prenatal vitamins now you get across the counter at Costco and many of the just department stores or pharmacies without any problem. And those have everything you need in them to help you in the pregnancy. So you don't have to add a lot of other things to it. And we really discourage people from adding others, okay, without discussing that with their doctor. But certainly those are the kinds of things that we want to try to give you education about before we talk about this. Dr. Mason talked about this, having a preconception counseling. These are the things that need to be discussed before you start, okay, so that we make sure, and it'd be nice if you brought your husband in or your significant other in, so everybody heard, okay, what you need to do to prepare.
Well, because as we talked about, especially when it comes to infertility, the cause is not all, it's not often attributed just to the female side of that. There's the whole other side. So everybody being on there with vitamins, working out, and all of that.
Keep your stress level down.
Yeah.
Just making yourself the best result, not being exposed to chemicals, alcohol, all the things we already know, but certainly that needs to be brought to the forefront again so that you're aware of it. Yes.
I was just going to add to all of that, coming back to the idea of being balanced with it not, if it's creating more stress for you to be on the fertility diet or to eat these certain things and take all of these supplements and you're rushing from this to this to this, then that actually may not be beneficial. So really looking at moderation and being healthy and taking supplements and making good choices, but at the same time, not where it's breeding obsession and you're so stressed about it, if that makes sense.
Yeah. And I know we talked early on in the discussion about how women are generally having children later than they did 10, 20 years ago. What are you guys seeing, and what are some of the challenges to women having children later, and in some cases much later?
I have a 49-year-old I just met with a few weeks ago, and they've been trying for years and years. And so due to age, they're using an egg donor, and they've taken some time to get to a good place mentally. But physically, I'm certain she's been referred to an MFM and had a little workup to make sure physically that she can have a healthy child. That's kind of more of the physical part. But then, of course, the emotional part is, on one hand, there's lots of benefits to being an older parent. Everything from maybe having more patience or having a little bit more time in your schedule. But at the same time, being aware of, how will you feel when a lot of the parents may be pregnant. And a lot of the times couples and parents worry about how will this affect their child. So we talk a lot about that.
And so what does that look like when you have that discussion? And what kinds of things are you wanting to make sure that you bring up with a woman or with a couple when you think about some of those considerations, age, using an egg donor, I mean, that brings in a whole nother set of maybe at a minimum complicated feelings about it. And how do you share that with the world if you share it with the world? So that's some of the things that kind of really come up in that conversation, things for people to maybe start thinking about.
Sure. I think for me, one of the first things that comes up is when you're trying to make decision is the idea of active versus passive decision making. So the idea that are you wanting to get pregnant or knowing that you might need help and just allowing time, which is a lot more passive, or are you going to be more active and seek out consults and recommendations and actually pursue whether that's adoption or fertility treatment? No matter what the outcome is, what I have found, if you're taking more of an active decision-making role, then you're gonna have less regret. Does that make sense?
Yeah, it does. So I hadn't thought about it quite in that way.
So, yeah, so the idea of anticipation of regret. So are you worried now that you're gonna look ahead and then look back and be regretful? So what can you do to have some closure about that or to feel at peace about that? And so for me, the number one thing is informed consent. So what are your options? I have couples that will come and say, oh, I would never do adoption. Well, why? Well, I had a friend or I knew a bad experience. So going back to let's before we can rule out anything, what are the facts? Let's feel on some facts and be educated and learn, meet with an adoption consultant or meet with an agency. The same with egg donations, sperm donation, surrogacy. What are the options? Is it, we have to look at everything from the financially. I mean, there's a lot of these that we're talking about, a lot of expense. So, looking at that, how does that impact their choices and their ability? And also looking at, but again, going back to both partners being on the same page, where we may have one partner who's ready and let's go, and the others, angsty or nervous, and so being informed, I think, is a big step with that.
So from your guys' side, once you maybe have someone who's getting to the point where they're about to go through some infertility world, they're a little bit older, how does that change things in the dynamic for you guys?
I think it's just optimizing care ahead of time, right? Are you, healthy to be going into pregnancy? Because our goal is to keep you healthy during your pregnancy as an obstetrician. So I don't do, a lot of fertility management in that regard, but have you thought through a couple of the steps down the road? And are you on medicines that are unsafe? Can we switch you to different ones? Kind of working with primary care in that regard. But I think the same, just understanding pregnancy is a long road, and are you ready to go through that? And can we keep your health optimized through that so that we get a healthy mom and a healthy baby at the end of all of this? And so I usually refer my patients both to a fertility doctor, but sometimes also to a high-risk specialist. Like, what is this going to look like? How are you going to feel if we have a preterm baby in the NICU? How are you going to feel if this doesn't work out? A therapist or a counselor, I think, is really important for these couples too. Just thinking about kind of the whole system from the beginning, I think really helps people. Knowledge is really powerful, so that it doesn't feel maybe as unexpected if there are bumps along the way. It's kind of how I just try to talk people through it a few steps down the road.
Yeah. And Leslie mentioned she has a patient now who's 49, which that's definitely kind of getting up there in age. I mean, are you guys seeing patients who are in their 40s?
Yes, we have many couples that are in their 40s. I mean, people are starting their families late. So it is not unusual for them to begin having children in their mid-30s. This is very, very common. So if you're planning to have 2 or 3 children, perhaps 4, then yes, we see ladies in their 40s having babies. And certainly making them aware of what the risk factors are associated with having a child at this time. Certainly making them aware of what they need to do to prepare for pregnancy, what they need to make sure that they are consistently doing in their families to make sure that that pregnancy goes well, that they have the appropriate support, because that's going to be very, very important. And that certainly they're planning their lives around what's going on with this pregnancy. rather than the other things that are going on. Okay, because it is so important for them to share that. Okay, because that's a lot of stress. It creates stress. But I think certainly as physicians, we can be helpful in helping to remind them, okay, of where they need to focus. Okay? And they have lots of visits with us in pregnancy. So we talk lots of times about what is going on in the family, what else is happening, what's going on in your job, how is that affecting? How many hours are you working a day? How many hours are you on your feet a day? You know, we're used to being, and certainly when you talk about ladies that are in their 30s and 40s, they're oftentimes in jobs that are extremely stressful and very, very active. Okay? And certainly going into a pregnancy that you have to do less of that can create stress for them. Okay, and because they're used to performing. Okay, women are, we do a lot of things. We wear a lot of hats. And certainly when we have to take care of a pregnancy in our bodies in order to get a pregnancy to term, it changes. It changes, and we have to change it. And I think that we can be helpful, and certainly counseling. We refer women to counseling during their pregnancies, oftentimes, because it's difficult to make that transition and not feel like you're leaving something out and you're not doing something that you should be doing.
Well, Leslie mentioned kind of this whole idea of being active versus passive. How does a woman, a couple decide that, hey, it's been long enough, now it's time for me to have that infertility discussion? I've been trying long enough. Like, what does that window look like? Is it you try for a couple of months? Is it kind of what age you are? Like, how do you know when you actually need to go have this infertility discussion?
Usually you try for about a year.
Wow. Okay,
Yeah,
so
you try,
year.
give yourself a year, okay, of unprotected intercourse to try to achieve pregnancy.
Even if you're
Now, if
40?
you're much older, then we gotta cut that time down,
Okay.
okay, because we've already been trying, but we've been avoiding trying.
Wow.
Okay, all right, so we have the system down pat, okay? Now what we need to know is, what are the things that we need to do to maximize our pregnancy potential? So I think that has to be individualized to the person. But usually couples, 90% of couples will be pregnant after a full year of unprotected. And certainly if you have not had that, no matter what age you are, okay, then we need some discussion. Okay, that doesn't mean you're infertile, but there needs to be a discussion with your doctor, okay, on what needs to be done to evaluate that.
Okay.
And certainly women that are coming at their 40s to achieve pregnancy, we're on point that day, okay, to start and begin to evaluate to maximize their pregnancy potential, because we want to lower the risk of any of the health problems.
So once you get to that point where you've been trying for a year, however long it is, based on your age, you get to the point where you're like, hey, I'm gonna need some extra assistance. How do you know, what metrics do you use to figure out who to go to? I mean, there are so many choices. That's one of the beautiful things about Houston is we have so many medical professionals.
That's it.
How do you know how to find the right one for you? Because even though, you know, let's say 90 out of 100 are amazing, it still might not be the right one for you. How do you find the right one?
I think basic fertility workup can be done with your gynecologist,
Okay.
like who you've been going to for your pap smear and your birth control previously, or the one you built a relationship with. You know, there are a few things that are more commonly related to a couple's ability to achieve pregnancy. How regular are your periods off of any hormonal intervention? Structurally, how is everything shaped inside your body? You know, do your hormones go up and down the way we expect them to be? Is your husband in good health? Does he have a history of anything that could be a red flag as far as sperm production? So there are a few fairly easy workups that can be done with just your regular gynecologist to see if your ovarian hormones look good. Are you ovulating? Is structurally everything look healthy to hold a baby, grow a baby? And then we can order often just a semen analysis for your husband. He doesn't even have to see anybody else. The gynecologist can order that for them. And those are kind of the four things I talk to couples about the most. These are kind of the big things that can affect a couple's ability to get pregnant. So we'll start there. And if any of those are abnormal, then we can start talking about how to work around them or fix them. And sometimes if we don't find anything, we fall into this kind of frustrating and unexplained category. And that is when you would want to maybe start seeing a specialist. And there are so many great specialists, but a lot of times just for the kind of the 1 month it takes to collect data, that's how I talk to couples about it. You don't have to skip a month. We just collect data all around. We can get a lot of reassuring information about what's going right or potentially what's going wrong. And then, we can make those referrals beyond what we can handle as just the gynecologist you've built a relationship with these past years. So.
Got it. And you mentioned hormonal therapy, so things like birth control pills, which a lot of women have been on. Talk about the role that does or doesn't play in your, obviously when you're taking them, you can't get pregnant, that's the point, like we all get that. But does taking them at some level of your life have any impact on your ability then to get pregnant later?
It doesn't really impact that, but your system may be affected prior. A lot of times people say that, well, I took the birth control pill 15 years and now I can't achieve pregnancy because my periods are irregular. They were, if you look back, your periods were irregular before. Okay, so it simply puts the system in a little freeze frame, so to speak, until you come off. So certainly if you've had very irregular periods before, then that's an indication you might want to come off those pills before you're interested in achieving pregnancy to see what your system is able to do and how it actually works. Because that ovulatory potential is what's going to help you to achieve pregnancy. So it doesn't really stop it. The pills that we have now are such low dose and so minimal risk, okay, that really you just take them and just stop them. And they'll come right out of your system. Then we get to see what system do you have, okay? And that's what's so important to discuss with your gynecologist, okay? What were your periods like before? How was the bleeding before? How often did they come? Because those are the things that tell us what your ovarian system actually is doing. And then we can measure those levels as well. We can't measure them when you're on pregnancy.
Of course. Yeah, and Dr. Beeson, you also kind of mentioned discovering kind of what your body looks like on the inside. That's crucial. And we probably all know someone who has fibroids, who's had ovarian cysts, all kinds of different things. So talk a little bit about some of these things that women deal with as part of their reproductive health that then can have an impact on their ability to get pregnant.
Yeah, I mean, I think there are, structural changes within the reproductive system that can be preventative as far as conceiving or being able to carry a pregnancy to term. So things like, endometriosis can cause scar tissue, particularly around the fallopian tubes, and then the sperm and the egg can't get to each other. The road's basically closed. There can be, structural tumors within the uterus that if you do get pregnant, a little embryo can't stick and grow there. So those are things you want to be able to evaluate. And certainly your gynecologist can have some suspicion based on parts of your history. But I think it's just getting good established care kind of helps you ahead of the game once you are ready to start trying to make sure there are no red flags there.
Yeah, I think that, and I would agree with Dr. Mason, I think that certainly having regular exams is what's going to give you the information, because certainly your gynecologist is doing your public exam at least once or twice a year. So anything that they feel related to fibroids or masses or cysts or anything along those lines, they're going to give you information on. And they're going to begin to evaluate that whether or not you're interested in pregnancy, because these are important things to your health and making sure that you're okay. So once you get that information, then its effect on your fertility can be discussed. Certainly the objective is to make sure that we're maintaining your health at its maximum.
Well, this has been a really wonderful discussion. I'm going to check in and make sure we didn't have any questions that we didn't get answered online. Do we have a few? We do. I'm seeing it. I'm seeing it. Yes. Awesome. Oh yeah, I love this. I was actually going to ask this next, and I thought, well, are we getting close on time? So I'm glad someone brought it up. Talking about postpartum. And that's a lot of things. That's physical, it's mental, it's emotional. Where do we even start with that? Who wants to kick us off on what postpartum life looks like?
It could be a whole talk.
That's a whole nother topic.
That's a whole nother topic, yes. It is.
We have wonderful Gabby here in our audience. And when I think about postpartum, I think about village, and I think about the importance of knowing, being informed and knowing what that is. And I'm sure that, of course, is going to come, from the physician office. I know they all do a great job in doing, before they leave the hospital and then at the check-in. But a lot of women don't really know that they have it. It might be their spouse or their mother or someone, or maybe even the physician or the questionnaire that says, hey, I'm concerned or worried. So being open to help and assistance, and just knowing there's so much, again, especially in Houston, there's so much out there We have some amazing reproductive psychiatrists that are wonderful when it comes to medication. And of course, as far as there's lots of us in Houston that kind of specialize as far as therapists with postpartum. And I think that being able to kind of meet the patient where she is and know that she's not alone, and give her the biggest thing I hear from a lot of these women is, I'm so afraid I'm never going to get better. I'm so afraid that what's happening. This feels so different. I was so excited. I tried for so long to have a baby, and I love my baby, but I'm so unhappy, or I'm so stressed, or I'm having these crazy thoughts. And so again, going back to normalizing that and helping them see that there is hope and that they do get better. And so hopefully for me, I see a combination of both medication. And a lot of times it's just short term. I think they hear, oh, I'm going to be on it the rest of my life. And that's typically not what we see. And then helping with sleep, helping with assistance, support, the motherhood center, support groups, any way to help them feel a part, again, that they're not alone. Being a new mom can be really isolating, especially with COVID. I've seen that where they're not wanting to get out there. And I feel like it's been exacerbated this last year. So that's kind of what I see.
Yeah, and that comparing thing, I think that so many women do, where, we all have a girlfriend who loved being pregnant, got pregnant super easy, loved afterwards, just everything was glorious. And it wasn't fake, it really was her. And for many of us, that's not the case.
Instagram doesn't help.
It doesn't. Thanksgiving dinner may not always, right?
They always tell you the best things
Yeah.
that are happening, and I think you need to be aware of that. But certainly, expectations, okay, are what help us, okay, to kind of avoid some of the postpartum depression that oftentimes can be seen, and to let people know that certainly this is not an unusual phenomenon. We often, in our office visits, the last few weeks of the pregnancy, we talk about these things. We talk about, this is going to be, we've been building up to this, we're going to have this baby. There's going to be a little sense of letdown, okay, that the baby's not as perfect as I thought it would be. It's not as cute as I thought it would be. Okay.
You're actually not going to get to sleep at all.
Yes, and I'm really not sleeping at all. And the baby is a lot of work. Okay, and those are all normal feelings. Okay, what have I done? I bit off more than I could chew. What is this? But those are all normal things. You don't have to feel like you're betraying your baby, or your maternal instinct because you're feeling that. And I think having those conversations with your doctor, somebody that you've built a relationship with, that's not going to judge you, but it's going to say, okay, yeah, I got you. Okay, these are the things we need to do. Let's talk about this. And being able to be open enough to say those things, to have a safe place where you can say them and say, well, okay, that's working. Okay, but this isn't working. And I think that this particular thing we may need to talk to somebody about. And that doesn't mean that there's anything wrong with your relationship. It just means that this is putting a little bit more pressure on you. And that I want to see you again. Let's get back together in a few days and talk about this.
And I think especially as we've kind of the theme of like having babies later in life and after you've achieved professional success, I find that those women struggle a lot. They're used to working hard, having high expectations for themselves, getting through hard things. And then this is hard in a different way. And they really put a ton of pressure on themselves about it. We've really changed our practice through all of this. And I know Dr. Ott alluded to, you get to see us a lot while you're pregnant. But there was a movement where you just didn't see your doctor for weeks after you were discharged from the hospital. You're just kind of left to navigate it alone and with your pediatrician. And I think there's a big movement in our field to change that. And so we see everyone, whether you have a vaginal delivery or C-section now, 2 weeks, 6 weeks, when the baby's 4 months old, when the baby's 8 months old, right? So you just don't, because it doesn't look the same for everyone. I think that's a really important thing for moms to remember. People struggle at different seasons of early motherhood. And I think your doctor's a great resource. Your pediatrician is, your obstetrician is. Don't feel alone. Don't feel like you can't reach out. We may be the first step in getting you to the next step, but just normalizing it with your doctor, that's your safe space, right? But also with your village, I think is just in the same line as pregnancy loss and infertility and postpartum struggles. Just kind of normalizing this conversation, I think is just going to be wonderful for women.
Yeah, that first year, okay, it's a big deal to all of us. Okay?
Yeah.
And it's okay to know that it's a big deal. Yes, and it's okay to come back and say, I'm not quite working, it's not quite working. Okay. And that's a safe place for you to do that. And you should have a safe place with your pediatrician and with your gynecologist. And they should be your point for getting where you need to go.
Yeah, and I would echo that and say, don't wait until you feel like it's overwhelming. Like, don't get to that point. It doesn't have to, because I hear a lot of my girlfriends, and even I'm guilty of this in every stage of life, of saying, oh, it's not that bad. There's someone who's got it so much worse. It's not that bad. There's no reason for it to be bad at all. Like, there's no reason for that.
It's
That's
supposed to
why
be
we have
enjoyable.
people.
Yeah.
Yes,
Yeah.
it's supposed to be
It's not.
enjoyable.
Let's figure out why.
Yeah,
Yeah.
exactly.
Yeah, I love it. How are we doing on time, ladies? Are we good? Do we have more to say? Great, because I have one more question. I just want to double check. I don't want to keep you guys longer. I know it's Saturday morning. I'm trying not to keep you up forever. It's keeping with the theme of like women doing everything and 100 million things. We're here on a Saturday morning doing this. I love it. We talked a lot here about kind of the emotional part of that. What about the physical part? And I'm open to starting with postpartum, how that can be super difficult, but then also the infertility piece. I mean, that's no joke when you have to go through all of the testing, lots of doctors, taking medications, giving yourself shots, all these other things. So can we talk a little bit about just kind of that physical toll that this whole process, I mean, we all know pregnancy is like a thing, but all these extra things, that we're kind of fitting into this year.
The infertility part is very, very difficult. Those injections and medications and certainly having a center that really deals with the emotional side of that, okay, along with the physical is going to be very important. So when you're picking your doctor or you're being referred to your doctor for an infertility problem for the couple, you want to make sure that they have all of those things available, because your husband has to be as involved in this, okay, as you are. This is a truly joint project. Okay, and certainly giving you those injections, okay, you're going to become very close, okay, with these types of things. And certainly it's going to change. You're going to have mood swings, you're going to have ups and downs, you're going to get frustrated with it. The counseling that goes with that is so important. Okay, having someone in that particular program that is checking up on you, checking up on the couple, and making sure that they're making the milestones that are necessary, because you'll have losses. Okay, and that's part of the problem. That every time you do an IVF cycle, even though it's very expensive, it doesn't always go. If you do an IUI or an intrauterine insemination cycle, it doesn't always go. We had embryos implanted, but none of them went. That's a loss, okay? And having a therapist there, part of the system to deal with that loss is so, so very important. Because the physical changes that are going to take, you're going to bloat. I mean, all those things we hate about periods and pregnancy, all that's going to happen, and it'll be 10 times that when you're working on your fertility. But you have to understand that. And the goal is so much better and so much greater than what we're doing right now. So everybody has to be involved in that, and everybody has to be on the same page for that, for you to make those transitions.
I think that talking about the physical toll, we can talk about things that are helpful to, as far as tools, if you will, to help women feel better, feel less stressed. I think part of the problem with fertility treatment is the things that you may find as a comfort or an outlet are off the table.
Right.
Whether
We're
that's
talking about the glass of wine.
Right, exactly, right.
Immediately I went there.
Right.
Yeah.
A glass of wine, traveling,
Wow.
intense exercise, sometimes bubble baths. I mean, things that you may typically choose as an outlet or to comfort yourself now are kind of off the table or not able to do, at least at that point. So they're having to find new ways to reduce stress. And I have a lot of clients that will do acupuncture, they'll do massage. Of course, we've talked about support groups and other ways to kind of, there's some wonderful meditations. Mindfulness is another great, just to kind of help with that stress. There's actually a really great meditation specifically for women trying to conceive called Circle and Bloom. And you can download it, and it's for women who are getting ready, just trying naturally, or women who are going through IVF, or women who are planning for their frozen embryo transfer. So it kind of meets them kind of where they are. So it's one more tool that they can do to kind of help with muscle progressive muscle relaxation, breathing.
That's fantastic.
Yeah.
Dr. Mason, you were talking before about how kind of it's changed in your field with seeing mothers more frequently after they have a baby. And I know part of that is that whole postpartum kind of mental part of that, emotional well-being. But I imagine some of that there's a great benefit physically too,
Yeah.
because unfortunately we've heard, you often hear the horror story, someone who had extreme hypertension afterwards and had tragic consequences. Nobody was paying attention, or bleeding afterwards and no one's paying attention. It sounds like some of those things are generally changing, right? About and why that's important.
Right, and I think, yeah, the conversation is changing, and one is why is it happening, and then the next is, well, how do we make it not happen? How do we prevent it? That's what we really like as doctors, like all the preventative stuff we can do. So I think being able to see your gynecologist gives you the opportunity to bring up symptoms that may feel normal, that you may be writing off as I'm just tired, I'm focusing on the baby, my girlfriend told me this is normal. It may actually be a red flag for your doctor based on how your delivery went, how your pregnancy was. I think it also gives us the opportunity to normalize things that are just normal, right? Breastfeeding is really painful. It's also really hard. It's doable with support and resources, but it takes time to kind of achieve that kind of glorious relationship everyone talks about. You're going to bleed for a while, and you grew a whole person inside your body. Your core strength is going to take time to get back. What can you do to help rebuild that without working against yourself? Sex doesn't feel the same after, right? To be able to come in and have a conversation with someone and normalize that and know that it will get better. Let's make sure everything is healed correctly. And if not, what can we do about that? And so I think that kind of closer care. And then of course, if you had diabetes, do you have diabetes forever? Do we start other medicines during your pregnancy that we can now stop? Or do we need to, optimize those? Make sure you're not developing blood pressure after the fact, right? Blood pressure complications after the fact. And so I think those are the things that we're really, I feel like are a big change in our field. And I've only been in practice for 10 years, much less than Dr. Mott, but I think that it's a good thing. And I think it's really helping women. And I think it's going to improve families and women's health in general, because that year after they deliver, they're going to be able to recover and go into their next pregnancy healthier than before.
Well, I just love this. You guys, this was such a treat to get to hear from each of you today. And I hope that there's one thing at least that each of you can take away. I know for me, I always love having this conversation because I feel like the general theme for us today is please talk.
Yes.
Please talk to your doctor. Please talk to your support system, whatever that looks like. And not just talk, but be active. I mean, I love this whole active thing of like, don't just be on Googling, like let's actually get to the people who can help you and really give you some facts and some actions so they'll help you achieve your goal, whatever that goal at that particular point is. So thank you guys so much for being here today. Thanks you guys for joining us. Are you gonna bring your You're gonna try. Do it.
Yes, so wow, as honestly as a 33-year-old, that was like the best thing I paid so much attention to so many notes, so thank you so much. We really want to thank them for giving us their Saturday morning. I know that there's tons of things that we could be doing. So thank you, Casey. Thank you, Dr. Mott, Dr. Mason, and Leslie. This has been a topic that is actually buzzing around, but people don't actually get to talk about it. So thank you for breaking that barrier for us. We understand that this is valuable information. So if you feel like someone is wanting to hear this or needs to hear this, please feel free to share this. We're going to post this on YouTube. I didn't even introduce myself. I'm Andrea Watkins. I am the program supervisor for the Women's Fund, and I'm hardly in this role. I'm always in the back watching this stuff happen. So it's such an honor to be here. And if you have any questions, please feel free to email the health educator at thewomensfund.org. We will pass those questions along to y'all. And this does conclude our Doc Talk for the year, but we're excited to do more of these hybrids in the following year. So if you have any recommendations of topics that you want to hear, we would be happy to take those. And we couldn't do this without the John P. McGovern Foundation and the Wendy Haskell Meyer Endowment. They have been supporting us for close to 35 years.
So thank you again. If you like us, if you like this discussion, post it on Facebook, share it again, and we will talk to you next time. Thank you.